I'm glad you spoke of access because that was going to be my next question. We've seen in several scenarios where access is not always equal or timely. And even though we see a lot of tech transformations, even in the healthcare sector, especially when it comes to research and development, all of those technologies really trickle down after a lot of months or years across the world, especially global south, the African continent. What sort of policy change or outlook change are we looking at on that front to ensure that we minimize the gap between the West and the East?
I think it's access, it's equity, it's also about viability of the market and how you can bring together a set of policies to really increase the likelihood that you'll have access to these life-saving medicines. And I think many parts of the world, through various programs that we do at the Forum to help facilitate and strengthen regional competitiveness and innovation. And so where we're seeing progress is where you see a deliberate set of policies, a clear vision about what a country or geography wants. Oftentimes that needs to be matched with the values of its citizens, in terms of speed versus safety. I mean, each part of the world has a different view on that. It's important to respect the integrity of those decisions. But where we are seeing more deliberate policies, more consistent incentives, you're seeing an increase in access. And so I think it's right that each country and each region evaluate what is the appropriate priorities that they have, but most importantly, have a very clear vision, be working with the private sector to evolve that vision, and also, the incentives and market mechanisms that underpin that in a more consistent way, and not maybe falling to the temptation of more short-term, quick wins types of things when engaging, with industries.